Hello, I'm Dr. Oleksii Kalmykov. If you're over 60, supplements can help, but only in specific situations, and they can also cause real harm when the dose is high, the reason is unclear, or they collide with your medications. Today, I'll give you a practical, evidence-based way to think about 8 things. 4 common supplements people often take unnecessarily, and 4 nutrients that can be reasonable to consider depending on your health conditions, medications, diet, and lab results. Quick safety note: this is general education, not personal medical advice. If you have kidney disease, a history of kidney stones, liver disease, osteoporosis treatment, anemia, heart rhythm problems, or you take blood thinners like warfarin, talk with your clinician or pharmacist before changing supplements. Now let's start with the 4 that commonly create trouble. Number 1. High-dose preformed vitamin A, also called retinol or retinol palmitate. Vitamin A is essential, but more is not better. High retinol intake has been associated in some studies with lower bone density and a higher hip fracture risk, especially at higher intakes. This doesn't mean everyone over 60 must avoid vitamin A. It means avoid high-dose retinol supplements unless a clinician has a specific reason and is monitoring you. The NIH sets tolerable upper intake levels for preformed vitamin A because toxicity is real. A safer default is food first. Colorful vegetables provide carotenoids, and your body regulates conversion. Number 2. Iron unless you have confirmed deficiency. Do not self-prescribe iron for energy. Iron is appropriate when you have confirmed iron deficiency or iron deficiency anemia or another clear indication. But taking iron without a diagnosis can irritate your GI tract, and it can also mask what's actually going on. Here's a key point. Ferritin can be high from inflammation, infection, liver disease, or metabolic conditions, even when iron handling is abnormal. So 1 ferritin number is not a green light to treat yourself. If fatigue or anemia is a concern, ask for a clinician-guided workup, a CBC, ferritin, transferrin saturation, and an evaluation for bleeding or inflammation. Number 3. Calcium supplements as a blanket rule. Calcium is essential for bone and muscle function. The controversy is routine supplementation in people who can meet needs through diet. Large reviews find fracture benefits from calcium supplements are small and inconsistent, especially for hip fracture, and the evidence is heterogeneous. On safety, the evidence is mixed. Some analyses suggest possible cardiovascular risk with calcium supplements, while other research does not. The NIH summarizes this as mixed evidence with potential harms like kidney stones and uncertain cardiovascular effects. So the responsible message is not never. It's this: assess dietary calcium. Consider supplements only if you cannot meet needs through food or you have a specific clinical indication, and avoid excessive total intake. Number 4. Chronic high-dose vitamin B6, especially from megadose B-complex products. Vitamin B6 neuropathy is well documented. Risk depends on dose and duration, and safety limits differ across authorities, but chronic high-dose use is a clear hazard. If you have tingling, numbness, burning pain, or balance problems, do not assume it's just aging. Get evaluated. Now, let's flip it. Here are 4 nutrients that can be reasonable to consider after 60, not because everyone needs them, but because intake is often low, absorption can change, and some medications increase risk. Still, each one needs context. First, magnesium. Many people have suboptimal intake, but that's not the same as a proven deficiency.
If supplementation is considered, start low and watch for diarrhea. And be cautious in kidney disease because magnesium can accumulate when kidney function declines. A practical approach is magnesium-rich foods, nuts, legumes, whole grains, leafy greens, and supplement only if diet is insufficient or there's a clinician-guided reason. Second, vitamin D. Aging skin makes less vitamin D, and deficiency is common in some older adults. But dosing should be individualized. The NIH lists a tolerable upper intake level of 4,000 IU per day for adults for routine use. And for community-dwelling older adults, the USPSTF recommends against routine vitamin D alone or with calcium for primary prevention of fractures, and against vitamin D for fall prevention, because broad benefits have not been shown. So the safer plan is test if your risk is high, treat deficiency under supervision, and don't turn vitamin D into a cure-all. Third, vitamin B12. Absorption can decline with age and with acid-suppressing medications. If you have fatigue, memory changes, gait imbalance, or neuropathy symptoms, B12 status should be assessed as part of a broader evaluation. Do not self-diagnose. B12 supplementation is generally safe, but use it to correct a documented problem or a clear risk situation, not as a universal promise of brain rescue. Fourth, omega-3. Fish first. Eating fish is consistently recommended in dietary guidance. For supplements, evidence is mixed. Some high-risk patients benefit from prescription EPA, icosapent ethyl, but over-the-counter fish oil has not shown uniform cardiovascular benefit in trials. And higher-dose omega-3 has been linked in some analyses to increased atrial fibrillation risk. If you take anticoagulants or antiplatelets, or you've had atrial fibrillation, this is a clinician conversation, not a buy-a-bottle decision. Now, here's your simple action plan. If you do nothing else, do this. 1. Bring every supplement you take to one visit and do a medication supplement review. 2. Avoid high-dose retinol and chronic high-dose B6 unless supervised. 3. Do not self-prescribe iron. Evaluate anemia properly. 4. Prefer calcium from foods. Supplement only when needed and avoid excessive total intake. 5. Consider magnesium, vitamin D, B12, and omega-3 only in context, diet, risks, labs, kidney function, and medications. And now, the red flags. Seek urgent care for chest pain, fainting, severe shortness of breath, black stools, new one-sided weakness, or sudden confusion. And if you have persistent dizziness, numbness, or falls, get evaluated promptly. Healthy aging is not about taking the most pills. It's about taking the right interventions for your body and your risks, safely and with evidence.